This is a 38-year-old female who presented with headaches, amenorrhea for a few months, and an elevated prolactin. MRI showed a pituitary lesion that was non-enhancing. It was T1 hyperintense before contrast. We figured that this may be a Rathke cleft cyst or a hemorrhagic lesion that caused apoplexy. We decided to offer her surgery because her headaches were quite unbearable, and she was also having endocrine symptoms, primarily amenorrhea. We did the surgery endoscopically using the transnasal transsphenoidal approach, and Dr. Leibowitz is my partner in this case. He's an ENT surgeon. We are removing the bony floor of the sella, and now we've exposed the dura, checking with the neuronavigation our bearings to ensure that we have adequate exposure. Here we're incising the dura in cruciate fashion. And here we start removing the lesion. The lesion had a hemorrhagic component, and the tissue around the hemorrhagic component was apoplectic. So here you can see the use of endosnap. So we're getting the same view on endosnap with a pseudo-colored image of the tumor in green, and it matches perfectly what we're seeing with the endoscope. Here you see a very beautiful image from the left lateral recess of the sella against the left cavernous sinus, where we're trying to remove any residual lesion. And again, it's a perfect match of the endosnap image with what we see on the endoscope. And here we're checking again using endosnap and neuronavigation that anterior knob that went over the tuberculum sella, and we want to make sure that it had descended and had been removed. And that was indeed the case. So the tissue that you see now is normal pituitary gland that has descended into our field because we have removed the entire hemorrhage and the apoplectic tissue. And as you can see on the MRI after surgery, the lesion is removed and the patient felt much better. Her headaches went away and her endocrine profile remained essentially normal. So this was a great case illustrating the use of endosnap in endoscopic transnasal surgery for a pituitary tumor.